Doctor, what's the best way to know if the pain is from my gums or tooth decay?
Um, Tooth, if you have a tooth that is hurting, and normally we do have some certain tests that we do, we tap on the tooth to see whether you're hurting from the tooth. Sometimes it's a little bit like what we call it as a referred pain. Sometimes you have a tooth pain that is going to be referred to the gum. You may have some pain around the gum, or it's the other way around. When you have some pain around the gum, then you are going to have some referred pain onto the tooth, where it's going to feel like it is a cavity. But there are some certain tests that we do. For example, what we call it as a pulp testing or an ice testing we do to see whether the pain is coming really from the tooth, or we call it as a tap testing, which we are going to tap on the tooth to see where is it coming from. And for diagnosing the gum disease, what we call it as a probing, and we are going to use our measuring tool to go around the gums to measure how much of pocketing or bone loss or gum disease you have, to diagnose whether the pain is really coming from the gum disease. And then on the top of that, what we call it as a 3D imaging, or the CBCT, the CT scan, we are able to, a lot of times, able to tell, along with the CBCT and the clinical findings we have, whether the pain is really coming from the tooth or from the gum. So the real simple answer is go see your dentist to see whether the pain is coming from the tooth or the gum.
That's right. Go see your dentist.